There are many in the healthcare field who say these worker shortages have been a long time coming. Eric Wellman is a professor of emergency medical services, or EMS, at Southern Maine Community College.
Yeah, there they have seen enrollment in their EMS training programs drop by about 20% over the last decade. Wellman says that decline has been hurting Maine's more rural areas first, but it's starting to be felt in larger cities.
I've been involved in conversations for probably the last 5 years about shortages in various realms of healthcare, that we knew that we were going to need to ramp up and create more workers and everything. I think COVID hit at an inopportune time in that sense, but I don't think there's ever a good time for a pandemic. It just exacerbated a system that was already struggling to keep and retain workers, and that's across healthcare. Even with good wage growth in other areas of healthcare like nursing and respiratory therapy and other things, we were still seeing shortages of people, and people were still looking for people before this happened. And now I think that's just gotten worse. And I think we see with the fact that many systems are having shortages of people, it is more the result of just years of needing more workers and not having them.
While many factors play into that emergency response shortage, Wellman says a lot of it can relate back to workplace changes. It's no surprise that more people are choosing quality of life and want to be paid for the work they do.
What would it take for you to work nights, holidays, weekends on rotating schedules, to be exposed to psychological trauma, to be exposed to death situations, and tend to be exposed to infectious disease and other things that can harm you, sleep deprivation? And what would it take you? What would be the hourly rate to get you in the back of an ambulance to do that work? And thinking about it even at a starting pay wage, and then what would it do to keep you in there for 25 years?
In the state of Maine, is there an average pay for an EMT or an EMS worker?
So we see with EMT wages, we see them range from anywhere from basic minimum wage, so no higher than what minimum wage is. And in some cases, you can get up as high as $22, $23 an hour in that case. But in those cases, they tend to be what we call the dual-rolled EMTs, which also tend to be attached to fire departments. So you have that mix. Now, there's always outliers in all of those things, and there may be a higher wage, but we see that EMTs do, which is our entry-level position, struggle with making a wage that is high enough to sustain only having to work one job. And then if you go to the highest level of EMS care, which is the paramedic, some of those are only making a few dollars more than the EMTs are, and they're finding themselves having to go to school for a year or a year and a half. So on top, a year to 2 years. Some of my neighbors to the north have talked about that people are leaving EMS altogether because they can get a job at Walmart for a higher pay, or McDonald's, or a Walgreens as an example. And these are good jobs in the sense of they pay a good wage, but they have substantially less responsibility for what is expected out of you out of your 40-hour work week.
You mentioned that some towns have actually experienced brownouts. What does that look like?
They're still answering all their calls, they're still getting to it, but what's happening is if they were running 10 trucks, they may only be running 6 trucks. If they were normally running the 10, they're only running 6. Or if they run just 1, they may have a period of time when they don't have any crew to man that ambulance, and they're notifying the town next door, and the town next door is covering for them.
Okay, so where do we go from here? Wellman says this is a problem that is not going away, and while state legislators can try to work out a better system of who pays for which services, whether that's a town, county, or state problem to tackle, the issue almost warrants a larger conversation about the American healthcare system. So a problem that has been years in the making and will likely continue for years to come.